Good morning to all the viewers. Today we are going to see about glucose homeostasis mechanism. Understanding blood sugar regulation is crucial for maintaining glucose homeostasis. Glucose is an obligate metabolic fuel for many tissues such as RBCs and organs such as brain and kidney. Lower blood glucose level causes severe hypoglycemia that can cause seizures, loss of consciousness, and death. Increased glucose level in the body results in chronic hypoglycemia, which leads to various conditions such as diabetes mellitus, glycation of proteins that results in neuropathy, retinopathy, and nephropathy. Hence, blood glucose concentration need to be maintained within narrow limits, which is in case of fasting 70 to 110 mg per dl. In case of random blood sugar, it is 140 mg per dl, and postprandial also it is 140 mg per dl. Glucose homeostasis is a term which refers to the balance of insulin and glucagon to maintain blood glucose level within a normal range. The process is essential for providing energy to the cells and ensure the overall metabolic health. Disruption can lead to serious health issues. The plasma glucose level depends on the balance between the glucose which enters the blood and the glucose which leaves to the extracellular fluid through the blood. The major source of blood glucose is through the diet, which occurs after the digestion and absorption of the food. The excess blood glucose after the process of digestion either is used for oxidation for energy production or is stored as glycogen for future use, or it is also converted as a lipid by the process of lipogenesis. In case of unavailability of sugar, glycogenolysis, which is a process by which the stored form of glucose from the liver is utilized and it is sent as blood glucose, and the levels of glucose are maintained. In the starvation state, a process called as gluconeogenesis, where glucose is synthesized mainly from the carbon chains of the amino acid. This majorly occurs during the starvation states. So these are all the various ways by which the glucose is contributed for the homeostasis. So coming to the phases of glucose homeostasis, this happens in four different phases: phase 1, phase 2, phase 3, and phase 4. A nutritional status of the glucose homeostasis in different phases are like this. Phase 1, glucose homeostasis is mainly based on the diet, that is well fed state. In phase 2, it is post absorptive state, and in phase 3, it is during fasting, and phase 4, it is prolonged fasting or starvation. The sources of glucose are diet in phase 1, hepatic glycogen and gluconeogenesis in phase 2, and hepatic and renal gluconeogenesis in case of phase 3, and renal and hepatic gluconeogenesis in case of phase 4. The tissues which utilize glucose during the different phases are: in phase 1, all the tissues will utilize glucose, which is a primary source of energy. In phase 2, all the tissues, but liver, muscle, and adipose tissue, the rate of utilization of glucose will be slower. In phase 3, brain and RBC and cells which lack mitochondria utilize small glucose, and small amount of muscles also utilize glucose. In phase 4, during the starvation, brain at a slower rate and RBC at a normal rate utilize glucose for its energy production. Major fuel for the brain in different states are it is glucose. In all the four different phases, brain is supplied with glucose, and in phase 3 and phase 4, in addition to glucose, the body also supplies ketone bodies for energy production in the brain. So let us discuss about the hormones involved in the regulation of the blood glucose. So two major hormones are insulin and glucagon. So insulin is the only hypoglycemic hormone which is produced by the pancreas that facilitates the uptake of glucose into the cells. So it lowers the blood sugar levels after meals and plays a vital role in metabolism. Understanding insulin function is key to manage the blood sugar effectively. Glucagon is another hormone produced by the pancreas itself that works in opposite to insulin. It raises the blood sugar levels by stimulating the liver to release stored glucose. This balance between insulin and glucagon is crucial for maintaining the homeostasis. In addition to glucose and glucagon, there are various other hormones which are involved during the stress and other metabolic and physical state of your body, like epinephrine, cortisol, and growth hormone, also has a major role in the regulation of your blood sugar. So these hormones can influence your glucose production and utilization, especially in response to stress and fasting. Regulating your blood sugar through understanding glucose homeostasis is vital for health. By recognizing the roles of insulin, glucose, and lifestyle factors, individuals can better manage their blood glucose level and reduce the risk of diabetes and other related conditions. Thank you for your patient listening.